audience, we have quite a few people who are non-Bengalis. And for them, I will be speaking in English, though I will be mixing in Bangla, Hindi, as and when it will be appropriate. So, before we start with this program, I would like to call my dearest Jonaki Mashi, who will be telling us a poem that she has written for us, for this program specially. And it is mainly suggesting why you need help. This is one topic we all think we know, we all think we have faced it sometime in our life, but we actually don't know it, don't know the real medical way. Today I will try to help you understand this disease in the simplest possible way, in the shortest possible time, with some visual audio aids. I have a team of friends over here who are all professionally acquainted with what they will be doing, what they will be presenting over here. And I would like to call Jonaki Mashi over here.
Ajke theme holo mon. Ta amar lekhata setai. Boddo ondokar চারিদিকে কিছুই তো দেখতে পাচ্ছি না কোথায় যাব কিভাবে বেরোবো কেন কারোকে দেখতে পাচ্ছি না কিভাবে কখন কেন এখানে এসে পৌঁছলাম কিছুই বুঝতে পারছি না বড্ড একা কার হাত ধরবো কার কাছে যাব সবাই কোথায় গেল আমাকে ছেড়ে না না সবাই তো ছিল আছে থাকবে কিন্তু যে যার নিজের জীবনে সদাই ভীষণ ব্যস্ত ওদের সময় কোথায় ছুটোছুটি আসছে আর যাচ্ছে ওদের রাস্তায় কোনো বাধা আসতে দেবে না দেখতে পাবে না সহ্য করবে না অগ্রাহ্য করাটাও তো শিখতে হয় তাই না তাহলে আমি কেন পারলাম না সব কিছু অগ্রাহ্য করে নিজের জীবনে সম্পূর্ণ একা থাকা দেখেও দেখতে পেলাম না জেনেও জানলাম না রাস্তা বার করতে পারলাম না বড্ড অন্ধকার চারিদিকে সেই অন্ধকারে তলিয়ে যাচ্ছি কেন কারোকে আমি দেখতে পাচ্ছি না
Depression is one of the most tragically misunderstood words in the entire English language. And I'm sure you know why. Depression has two radically different meanings depending on the context. So when a person generally says, you know, that person is depressed, अरे यार उसको depression हो गया यार इसलिए वो नहीं आ रहा है तुझे पता है उसका breakup हो गया कितना depression में है रे वो These are general things we hear, but that is generally used in local terms to just mean that a person is sad. It's a general normal reaction that every person has felt sometime or the other in their life, perhaps a little few moments every single day of their life when they don't get their way. But that is the thing. They express it for problems which have an outrageous fortune. Yet in clinical context, depression is the shorthand of a devastating illness known as major depressive disorder. And this is when a person will generally tell you, तुम नहीं समझोगे यार, तुम्हें क्या पता depression क्या है? अरे तुम्हें बता के क्या फायदा? नहीं समझोगे. When you ask the person, why are you behaving like this? They will say, it's okay. I'm fine, but they're not. And that's when every one of us can make sure that if they are really fine or are they in a verge of a real serious disease. Depression can be compared like the common cold of mental illnesses. You know, it's common after all, right? And it's so common that 1/4 of Indians are probably going to suffer from depression by the time they reach the age of 75 sometime of their life. Interesting, isn't it? So, Chandana, first slide please. I have a special thanks to give to my professor who has been a part of this entire 1-month journey, who has corrected my own definitions. I know, I'm a doctor, but there are things which have many technical terms which we need to understand. And Dr. Sudhir Bhave, who is now the leading practitioner for psychiatry, and he has helped me not only with the questionnaires, but every single slide that you will see today. Next slide, please. Two more people I would like to have a special thanks to. One is Dr. Chandak. He specializes in adolescent health, and that's why when you will see a slide on how it presents differently in children, it is mainly his contribution. Apart from that, one more senior of mine, Dr. Surbhi Mitra. She is a third-year resident in psychiatry right now in my college, and she has helped me organize the questionnaires as well. Alright, so like I said, Shanjana, next slide. What is it really? It isn't a bad hair day. It isn't sadness. It isn't grief. Those are all normal reactions that you feel. They come, they peak, and they go down. And you come out of that treacherous dungeon after some time. Maybe a couple of days, couple of minutes, couple of hours. But it never extends for weeks, months, where you cannot do anything, where you are stuck. I know at this point you must be thinking, oh my god, this talk is going to be so depressing. Spoiler alert, this is not that kind of depressing. I think I made my point. But this disease can be defeated, and that's what I'm here to teach you about. Because you know, at every level, during the at least initial stages of depression, each one of us actually plays the role of a psychotherapist. Most of us are not very comfortable going to a doctor. I understand that. An interesting fact is, a lot of people are so afraid of doctors that psychiatrists have decided not to wear the white coat in public presence because it apparently puts in a lot of fear in people's minds. The rate of depression increases generation by generation. And if you see the older days people, you will not find that much of depression. But as our generation is coming into the real world, we suffer for more depression. There are many reasons, and we will come to that. So next slide, please. So the history of depression. Funny thing, depression has been recorded since the 5th century BC. And at that time, it was mentioned as melancholia. It was black bile. It was one of the humors that was not well understood, yet it caused so much distress. What we see over these 2000 years is that the symptoms have actually not changed. The disease has actually not changed. It stays the same. History repeats itself, and that's why we can do certain things to modify our behavior in various ways that might help us to cope with it. So, by 2020, that is actually next year, depression might be the second leading cause of problems or disability that we cause. I think you might have heard it in insurance claims, claiming for disability. So after ischemic heart disease, this is the second most debilitating disease that we can think of. This disease is more common in women. Now there are many reasons why people say women are more prone to it. There are many schools of thoughts, and one of them which makes the most sense is the hormonal ups and downs. And I'm pretty sure you must have seen it in your own families that they feel morose, down at particular times of the month. Some people face it during their menstruation. Some people face it during pregnancy. There is a whole different term for depression postpartum, that is after a person has delivered, and it can happen up to a year after the baby is born. And even after menopause, many women face it. Apart from that, there is another reason why women might be more prone to depression, and I know men might just laugh at this reason. Women tend to think and overthink and rethink and go back to the root cause of something that happened someday. इसके वजह से शायद मुझे आज ऐसे हो गया. They tend to put it in they tend to blame it on something समझना ही नहीं पड़ता জানিস তো ও এরকম ছিল ও যদি এরকম না করতো আজ এরকম হতো না these are different dialects I'm just saying the same thing in different words but this is how we usually identify how women tend to pinpoint certain things and I don't know perhaps men don't think that much perhaps they choose not to think that much so that could be another cause why they don't suffer from depression that commonly as women do. Depression is a disease of civilization. There was a study which was done in a very small island and they are tribal people. So what was seen that these tribes, there were about, the population was somewhere about 3,000 and they obviously have to work way more harder than any of us can ever think of just surviving, let alone doing other work. So, from those 3,000 people, just one person was found to be marginally depressed. So, just like asthma, diabetes, perhaps it could also be labeled as a disease of civilization. When do you suspect? What do you generally see? I'm not talking about the medical terms. I'm talking about what a lay person sees in everyday basis in somebody who they know so well that they can suspect it in one go. And that is why I'm teaching you, so that you know these points, you pick up these points and you can help them as soon as possible and they don't progress to a real depressive state. Stop going to work. नहीं यार मुझे नहीं जाना है आज. Giving lame excuses every single day. यार आज मेरे घुटने में दर्द है, आज पेट में दर्द है. Those are common things. I think every single person has done that sometime or their life. Even I have. I'm no different. Well, it's not like that. When this goes on for a long period of time, when there is something wrong, genuinely wrong, and they are not answering back to you why they are not coming. Perhaps they don't want to tell you why they're not coming and you find something suspicious. Go with your sixth sense. Something is suspicious. Appearance and grooming. I'm not talking about no shave November. I'm talking about a person who is in general very clean. He has his ways. He has his own way of being messy. He has his own way of being untidy. But if it is out of the ordinary, suspect it. Posture. You must have seen there are a lot of emojis on your WhatsApp. The ones with the loop-sided, upside-down smiley. The ones with the little shoulder down, droopy neck. The back is not straight. They're actually right. That is exactly how a sad, depressed person will present to you. Their smile is down. The shoulders are drooping. They don't want to do anything, let alone standing up. They'll sit slouching, not because they're making themselves comfortable, because they don't care. Doing activities for the sake of doing it. I know a lot of people do a lot of things every single day for the sake of doing it. But when this goes on day after day and you really are pushing yourself to do it, that means you need to look back, think, is there something wrong? Lack of concentration. There are many things, it's hard to concentrate. I understand. Perhaps even this lecture might be at times very hard to concentrate. That's not depression. Depression is you're watching TV and you have no idea what's going on over there. You're doing your work in your office, you are at your bench, your boss is yelling, your co-workers are asking you what's going on and yet you just don't know why you cannot think. You know you have a deadline and yet you cannot push yourself. That is when there is something to suspect. Change in food habits. Some people tend to eat a lot at that time. Carbohydrates give out endorphins, which are happy hormones, into the body, and that's why you would see, especially young girls who are PMSing, they would see you would be craving ice cream, chocolate, biscuits, God knows what else, and that's okay. that's temporary. But when you are eating constantly, you can't stop your mouth, you just cannot think without something in your mouth. Or the exact other way around. When you see that you just don't want to eat, I just don't want it, nahi chahiye mujhe. Your mom is coming and telling you, beta, kha le. Or your wife is trying to tell you, Kigo, khabe na? And you always answer, na, aaj bhal lagche na. Na go chhede dao, ekhon khabo na. Why? Once or twice is okay, but day after day, isn't that suspicious? Social withdrawal. I know my generation tends to avoid public in general. But not going day after day to even simple things, simple places, simple parties, just socializing or just saying, hi uncle, how are you? And you see that person is just going away, not looking at you, not because that person is ignorant, but because he doesn't realize your presence. At that time, all he thinks is, मेरा क्या होगा? मेरे साथ ही क्यों? मुझे ऐसा क्यों लग रहा है कि मुझे तारे नहीं दिख रहे जब सबको दिख रहे? It's like that. Pessimistic talk. I think everybody of us have faced it. You tell the person a solution to their problem, they will give you a problem to it. Self-pity and hopelessness. This is exactly that I said. मेरे साथ ही क्यों? मुझे क्यों हो रहा है? That is what they tend to think a lot. And recurring thoughts of death. You see, when a person is depressed, it actually turns on the pain sensory regulations in our brain. And that's why when you ask a person, how does it feel when you're in depression? They would say, it's torturous, it's tormenting, it's agonizing. I just can't deal with this. I need to get away from it. And that time, death seems to be apparently a very easy way to get away from it. And that's why most suicides are very common in a case of depression. And you must have seen it in the first questionnaire that I handed in to you, that how would you know? I gave you a real case. You must have seen it every day in your workspace. And that's when you need to be alert. Shanjana is sitting right here in front of me. And she and her father, Shugato Kapu, they approached me when I came up with this idea, when we decided to do this topic. And Shanjana wants to break the taboo. She wants to tell her story. And she has been there. She has been there months after months. The reason she's not coming up on stage is because it is perhaps really tormenting to go through that once again. She's sitting here, she's helping me. She is a very smiley and very, very efficient helper I have seen in days. And I must say that in my generation, I know, you do not tend to see a lot of professionalism. But if she says, I will send it to you by 12 a.m., it's there at 11:59 p.m. Believe me, this is really happening. Yes? So, depression talking, diary entries. These are excerpts from my diary back in college. I woke up at 11:30 in the morning, fell back asleep until 2 p.m. The night before I laid in bed, watched something on Netflix. I can't remember now. The past week is a haze. I've barely had any energy to get out of bed, let alone do anything productive. Getting out of bed is just as difficult as falling asleep. I don't remember the last time I have slept before 4 a.m. Today I have managed to have some breakfast, and that's the biggest victory I've had in the last 3 days. My friend took me to a therapist who heard me out and suggested that we start with cognitive behavioral therapy. I see that psychiatrist in tandem who would prescribe an antidepressant to supplement my progress. My therapist to this day has been predominantly giving me new ways to contemplate the thoughts that come in my mind. The pills, although they have made me incredibly sleepy and irritable at first, have been successful in stabilizing my mood for most part of it. And seeking help was the best thing that could have happened to me. I have joined a platform called 7 Cups, where one can help by being an active listener, which involves not giving advice, but just being a person who is there for you, person who listens to you, someone to talk to and know about how they're feeling, or just to vent out. A questionnaire that I had given you, the page 2, that was for assessing you. And you must have seen these exact same points, except they were in question format, and to see the gradation of how you are doing. So, when a medical person is diagnosing depression, we need to see at least 5 out of these 8. We have a mnemonic. If you see the first few alphabets, it's called SIG, E, CAPS. So SIG, S is for sleep disturbance. Like I said, that some people tend to sleep a lot and some people don't sleep at all. Biologically, when we do EEGs or sleep patterns and sleep tests, there are certain rhythms that you see fluctuating every 90 minutes. The person who is depressed actually has a very different format. Most common symptoms that you would see as a layperson, for a layperson I can explain in this way, that they might perhaps sleep through the day, still feel tired, and then they might fall asleep again. Or they might be waking up at the weirdest possible hours, maybe at 3 a.m., maybe at 2 a.m., and just not feeling to do anything else because somewhere they feel that I haven't slept, somewhere they feel I need to do something else, somewhere they feel I should just lie here, but ultimately they don't do anything. They can't do anything. The next thing is interest deficit. They generally, you would see the person, we always find many hobbies, many things to do every single day out of office, at home, we have a routine, we follow it. But when you see that it's becoming tormenting to do those simple things, we know that you are having an interest deficit, especially when it comes to things that you love doing. Guilt. I think Shanjana has expressed it in the most beautiful way how the guilt comes. Concentration deficit, appetite changes, and psychomotor retardation. It means that you feel that you have slowed down from your general routine. A person who has psychomotor retardation will not think of suicidal thoughts, because for suicide, you need a lot of planning. You will never find a person who has committed suicide and hasn't planned out everything. If he has a pet, he will make arrangements for his pet. If he has money, he will give it to his family. He will make his business in order, and then he would find out a way to commit suicide. It doesn't happen all of a sudden. They always have it lurking in their mind somewhere. So when a person is having psychomotor retardation, they don't want to leave their bed. They don't want to do anything. They don't want to think. So that is the best time when a doctor actually doesn't have to worry if the patient is about to commit suicide or do something harmful. But the problem is, once the medications start working and they start feeling better, that's when they feel that मुझे नहीं झेलना है इसे वापस, and that's when they think, let's just finish it once and for all. Also come with weird symptoms which do not really explain themselves. Some may come with headaches, some may come with joint pains, some may come with something that is bothering them, and when you do 10 million tests, you are giving them needle pricks, you are doing urine tests, you do PET scans, you do MRIs, you do everything to really find out and make sure your patient is alright, and that's why you see that everything is normal. It might be that the patient is actually depressed, and that's when a psychiatrist or a psychotherapist might come into action. Why did I have to be this way? The best way to express this, perhaps, is in a dance form. So today I have two of my friends, Neha and Vaishnavi, who will present this in a dance format.
It's not that I don't want to be happy. It's that despite how hard I try, I can't bring myself to be happy. I feel suffocated, embarrassed, ashamed. Why did I have to be this way? I have a great family, amazing friends, good academic results on paper. Everything is okay. Yet all I ever seem to see is sadness and grey. It's like there's this burden on me, pulling me to the ground, and however hard I try, I can't bring myself up. I can't bring myself to care about anything, not me, not him, not her. Living has become this constant nightmare. And it's just not fair. Society will tell me to try yoga, go for a walk, listen to meditation. I tell them that this cannot be solved by exercise or medication. It's a disease that affects every aspect of my life, my work, my relationship, my education. And to this day, despite my best efforts to explain, I'm always met with blind hesitation. People ask me, why are you always so sad? I tell them I don't know. I don't know. What I do know is that I wake up every morning feeling like absolute shit, and that's become my norm. I'm afraid of the world. I'm afraid of putting my guard down in the view that I'll be judged for something that I cannot control. Where's the fairness of it all? Do you think I like to watch myself fall into this fall filled with self-hate, shame and love? So I hide and I put up a wall that is so high you will never see my pain or any of my flaws. I create this character, and she is perfect. She's invincible. And so I carry on living these two lives, one for the public and one just for me late at night. Because that's easier than admitting I have a problem. And that's the problem. The stigma is real, people, and it will not go away until we realize that mental health is a big deal. It's a hidden disease that affects so many lives. Wake up and listen to the silent cries. It's a kid who never speaks, or the man who's always tired, the woman who's too emotional, the guy who just got fired. Because he was absent enough. He couldn't get himself out of bed due to his mental health, but do you think any of his colleagues knew that? Of course not. Depression is the hell inside of me, and it eats me up daily.
Now, in adults, I already told you, we have Siggy caps. But in children, they tend to present in a different way. They cannot express things the way adults do, after all. And many a times, the biggest problem is parents tend to overlook it. Why? They might just think, "Oh, to nakami korche, beshi barabari korche, ekdom porte boshe ja, kono kotha bolbi na." It's good. I definitely do not support spare the rod and spoil the child, but there has to be some place where parents need to understand, and sometimes they miss it very unfortunately. So it's usually the teachers who come up and tell the parents that, you know, I have noticed that something is wrong with your child. And the saddest part is, as young as 8 or 9 years old children come up to our clinics. Dr. Preetham Chandak, whose name I said in the beginning, he was telling me mainly about the cases that he sees on regular basis. And generally, the parents, when they bring the child in, they said, teacher ने बताया, बच्चा सुनता नहीं है, बहुत चिड़चिड़ करता है, बहुत जिद्दी हो गया है आजकल. You know, आजकल, that is the term. The child was not ziddi from before, perhaps, or something that he usually does. Maybe the child was actually ziddi in real life, but is actually now very calm, quiet, not doing anything, not eating, not sleeping, doesn't want to do things. Many times, there are cases, maybe they've been bullied. Maybe they've been told certain things that have embarrassed them so much. तो तेरा किस्सो हवे ना, उस बच्चे को देख क्या कर रहा है वो, तू ऐसा हो गया, तू बड़ा होके क्या ट्रम्प जैसे बनेगा क्या? This is literally what I have heard in my own ears, in my own family, when they say कि तू तो ऐसे ही है, तेरे दिमाग में कुछ नहीं है, तेरे से कुछ नहीं हो सकता है, तू तो ऑटो चलाएगा यार. You never know when you are hurting your child. Sometimes it's good, sometimes leg pulling is fun, but that also can be bullying at times, and parents don't really realize that. There can also be different kinds of abuse, and that you need to know. And to find that out, you need to spend more time with your child. The problem is, everybody has phones. The child also has phones, and a lot of parents who come to us, they think that, you know, बच्चे को phone चलाना आता है is like a big achievement. Come on, we didn't have phones in our childhood. हम तो चला लेते हैं phone. Then they will also be able to cope with it. It's not a big deal. But yes, I'm not saying that don't have it at all. You are living in the 21st century. You have to move with the 21st century. So there are certain things that what we, every place in the world has a different range to how much the children should be allowed to have their phones, and the average is about 2 hours per day, but not continuously. You can give it as a reward system. Do your homework, you can play this game for 15 minutes. Finish that job, you can do it next. Clean up your room. That's how. You know, it's like the traditional method of star charting. This is one thing that psychotherapists or psychiatrists do when patients come in, children come in to their practices. You see, you cannot give much medication to children. There are very limited number of medications you can give. So psychotherapy plays a very important role when it comes to little children. And there are little things that parents need to learn first before the child does. And that's the problem by treating the patient. You see, an adult, if you tell them, you are having depression, perhaps this is something to do with depression or depression-like symptoms, the adult might accept it. But when it is for a child, just imagine, put yourselves in those shoes and think, would you really believe your doctor is saying your child is depressed? No, you would say that the doctor is crazy. Such a small child cannot be depressed, but it is so. So that's why what happens is when you give them medication, when you give them things, tricks, tips on how to cope, how to do cognitive behavioral therapy or psychotherapy, it is very hard to manage these patients because first of all, parents are not compliant. Second of all, it's a child. How can you expect it to listen to every single thing you say? It's hard. So you have to make it palatable for them. So there are things like you can make a chart, you can give them stars for every good thing that they do, or you can say, you know, you learn this, I will give you something small. It doesn't have to be something very big, or at least show the appreciation. Je beta, khub bhalo korechish, khub bhalo, aro kor. You can do that. Encouragement is actually more than enough. I'm not saying spoil your kids. I'm saying tell them that you have noticed that they have done something good. Did not mention, that's the last point, is unlike adults, you need to be more vigilant for depression in children. Because children sometimes can present bipolar disease as the first episode of bipolar disease can present with depression. Bipolar generally has depression mania or something of that sort with in-between phases of being well. The reason, some myths. This was one of the main things that we were going to discuss today, the myth busting. Children do not suffer from depression. I think I already made that clear, that they do, and it is important that we take it seriously. You don't need to express it to them that you're taking it very seriously, but make sure that it is noticed. Excessive worry causes depression. Worrying can be a risk factor, and some people have a tendency of worrying more because it is in their genes, just like depression is in their genes. But that doesn't mean that a person who is always fidgety, always worrying, always having little OCDs about constantly cleaning, constantly scolding you, those things might not be one of the causes of depression. If a person is depressed, there has to be an external factor bothering them. It doesn't have to be, there can be an external factor. That's why when, in simple terms, if we have to explain what depression is, it is an imbalance in hormones or chemical regulation with some genetic factors which are made worse with external factors such that you cannot appreciate a simple sunset. That's the simplest way of explaining it to you. When a depressed person expresses suicidal ideas, he doesn't mean to act on them. People say you're perhaps encouraging them. If you talk about it, perhaps he has some sort of, he's just playing around, just fooling around, just thinking of these things as a random thought, but no. It's always good to ask, why do you say so? It should be a close-ended question, so an open-ended question, an open-ended question so that, the person gets a chance to express to them what they're actually processing in their mind. Otherwise, you would never know. Discussing about suicidal ideas can induce them. I think discussing about them perhaps will keep you aware that the person is about to do something very harmful. Talking about depression worsens depression. I think Shanjana is the biggest example over here who has who has already said that this myth does not exist. Next one. Antidepressants change your personality. No. They work on certain chemicals that change, make it up or make it down as per your requirement, but they do not change your personality. Yes, a person might think that this person is being very happy after a very long time, or is being fidgety or being angry. This happens generally when the medications are just started. But that doesn't mean that the person has changed, his personality has changed. It's just that the drugs are changing some things, some regulations in his body. Alcohol consumption reduces depression. A lot of my friends, a lot of my grown-up family, they say that, it gives me that happy high. एक पेग, बस, सब ठीक हो जाएगा. अरे वो तो बोलने लगेगा, उसका जितना टेंशन है सब निकल जाएगा. Yes, they probably talk, they probably feel happy, but that happiness is very, very momentary. The problem is, alcohol actually works on the very similar receptors in our brain that our brain causes depression, the chemicals that cause depression are. So that is one thing. Alcohol will increase your depression. In fact, this afternoon itself, my father forwarded me a paper, a nature paper, which was actually published a couple of months ago, which suggested that people who are chronically drinking alcohol, and I mean even if one peg every day, that's chronically drinking every single day, it has been shown that the genes that work on depression, the genes that cause depression, they tend to become more activated in a person who has been consuming alcohol for a very long time. Now that we're talking about genes, we have two sets of genes that are coming from, one from our mom and one from our dad. And these basically tell us if a person might or might not have depression, because it is partially a genetically inherited disease. So imagine a person who is already genetically susceptible is consuming alcohol. Obviously, that person is, he himself is jumping into the well, I would rather suggest. Depression happens only when something bad has happened. When something bad has happened, you are sad. You feel grief. You feel bereavement. If somebody has passed away, it is very normal to feel sadness up to 1 year after the person has passed away, and that is normal. But when it is not something like that, something that has life-changing thoughts, and still the person is depressed, that is when you need to think that it is worth concerning. Antidepressants are addictive. No, they are not addictive. A lot of people have this tendency, mat le, arey, you will never be able to get away from it. Ek baar lena shuru, to zindagi bhar chalega. No, it actually depends on how severe the case is. If you are suffering from severe depression, you will need it for a longer period of time. If it's a very short period of time, we will give it to you for a very short period of time, and the doctor that's why gives you the questionnaire, the second questionnaire that you all filled in. That is exactly what you get in a doctor's office. And based on the scoring, there are 5 categories on the scores, and we understand whether the person is mildly depressed, moderately depressed, severely depressed, and accordingly, we will help you out. We are trained that way, and that's why we want you to take our help. If you have all the material comforts, you cannot suffer from depression. I don't think I need to explain that. We all have most of the things that we have in life. Do you have a plan? A person who's going to commit suicide always has a plan. Do you have access to pills or weapons? Generally in India, weapons, they're not usually firearms. In America, you would find more of firearm cases. Here, either they would think of hanging themselves, cutting their wrists, or usually taking pills. Have you spoken to anybody? So that would give you an idea of what is going on, or he is on his own, or just formulating everything by himself. And have you tried to hurt yourself? And then the last thing is, are you alone at home? And generally people try to do it in a very unsocializing way. Obviously they don't want to show their faces to the world, and that's why they feel that that's the only option they have. So I have a mnemonic. It's very apt, sad persons. You can remember this mnemonic. S for sex or male, gender. Generally, women might try to commit suicide, but they are not really always successful in completing the suicide. A for age, young adults, my age group, or elderly, maybe 60 plus. Depression. You already know that that person has been in depression for a while, and the type of depression that I have been explaining to you. Previous attempt. Ethanol or drug abuse. Rational thinking loss. Sickness. People who've been suffering from a disease for a very long time and they feel that they don't have quality of life anymore. They might think of committing suicide. They have an organized plan. People who are lonely, people who are single, people who don't have spouses, people whose families don't look after them, they are more prone to it. And a person who has stated that I might do this in the future. So when should you seriously seek help? A person who has been in that phase for more than 2 weeks, and that is the medical definition, that all those symptoms, not feeling pleasure, not feeling guilt, feeling tired, feeling lost, all of these symptoms together, and they have been there for more than 2 weeks, go to your doctor. Any other medical problems with these symptoms, check with a psychiatrist. Significant psychosocial stresses, somebody who's having a hard time at home or at work or in school or wherever they go and things are not working out and they are stating that something, I might just do something wrong. Be aware and take them for help. And people who have said that they have suicidal thoughts. So, the best part of this lecture is it can be treated, and there are different ways that I will be explaining today, not just the medical part, through exercise, the psychotherapy, and we have an interesting session, dance therapy. So the first one is, I already mentioned, next one, psychotherapy. In medical terms, we call it as cognitive behavioral therapy. This was the term that Shanjana also used in her write-up. And what they do is, there are multiple sessions. The patient is brought in. to a counselor or to a psychiatrist or somebody who is trained in this profession, and you try to understand what's going on in their mind, their thoughts, their automatic beliefs, their distorted beliefs. You need to understand and listen to them first. And then you can modify it, right? Because once you identify the problem, once you can pinpoint the problem, you can slowly convince the person that, okay, try this out. Maybe this might work. Even to a patient and how they work. Generally, there are about 4 or 5 main classifications, and they work on 3 main neurotransmitters. There are many more, but in depression, mainly 3 go up or down. One of them is serotonin, one is norepinephrine, and one is dopamine. All these drugs are very good drugs, and not all these medications will work for everybody. One size doesn't fit everybody, so we need to do a lot of permutation and combination before we give medications to a patient. And these medications take about roughly 4 weeks to work. So what happens is a lot of patients, they think that it's just a waste of money and nothing is happening. Nahi leti main ye drugs. That's what happens. But you have to be patient. Your family is also taught, your friends are also taught that they should help you, they should boost you to take the medications. Do not stop medications on your own. That's when things become worse. That's when we cannot get back to giving you the kind of medication that might really help you. Next slide. So, my friend Orgho will be presenting something. Life is all about balance. The neurotransmitters, just like I said, when it goes up or when it goes too down, that's when we are having these symptoms. There is contradiction, there is creation, there is destruction. When this balances out, that's when life gets difficult. And so, my friend Orgho, who is a rising star, I think all of you have seen his posters on Facebook, he is going to present a Lokogiti, a very popular one, but the interpretation, perhaps you will think of it in a different way now that I have explained to you.
আবার সেই ছবিখান নষ্ট করে কুঞ্জনা কুঞ্জনা, সেই ছবিখান নষ্ট করে কুঞ্জনা কুঞ্জনা। তোমার ঘরে বসত করে কয়জনা মন জানো না, তোমার ঘরে বসত করে কয়জনা। তোমার ঘরে বাস করে কারা মন জানো না, তোমার ঘরে বাস করে কারা মন জানো না। তোমার ঘরে বসত করে কয়জনা মন জানো না, তোমার ঘরে বসত করে কয়জনা। রস খাইয়া হইয়া মাতাল, রস খাইয়া হইয়া মাতাল, ওই দেখো হাত ফসকে দেয় ঘোড়ার লাগা। রস খাইয়া হইয়া মাতাল, ওই দেখো হাত ফসকে দেয় ঘোড়ার লাগা। সেই লাগামখানা ধরে দেখো কুঞ্জনা কুঞ্জনা, লাগামখানা ধরে দেখো কুঞ্জনা কুঞ্জনা। তোমার ঘরে বসত করে কয়জনা মন জানো না, তোমার ঘরে বসত করে কয়জনা। তোমার ঘরে বাস করে কারা মন জানো না, তোমার ঘরে বাস করে কারা মন জানো না। তোমার ঘরে বসত করে কয়জনা মন জানো না, তোমার ঘরে বসত করে কয়জনা।
treatments that I have told you, psychotherapy and the medication. So when there are cases which don't work with either of these two, that's when doctors have to take a decision to go with electroconvulsive therapy. It sounds dangerous, and many of us correlate this with cartoons where Frankenstein is standing up and all his body parts are being sewn together, he's getting a new brain from somebody else and he becomes a whole new person. But this isn't what really happens. The patient is anesthetized and then he is given certain shocks in certain areas which are localized by the doctor, and then electroconvulsive therapy is given. It might take 1 or 2 sessions, sometimes more, but generally it tends to work in cases where nothing works, resistive cases, and acute cases where the patient is really suicidal. Try medication. And exercise combined with antidepressants, psychotherapy tends to work much better. And exercise itself on its own works very well. The problem with exercise is we don't want to do it. It doesn't come naturally to us. And the thing is, when we came as human beings on the earth, we never actually thought that we have to spare time for exercising. What we did in our everyday activity was exercise. Exercise is actually very beneficial, and I want to emphasize this because I can't emphasize it less. There was a study where almost, I think, 2,000 patients were taken. They were randomly classified into 2 groups. One group was given antidepressants and one group was told to do exercise therapy. After a stipulated period of time, it was seen that both the categories actually have pretty similar development or improvement in their symptoms. See, it's that good. How much do you need? Not much actually. At least 30 minutes, 3 days a week. It's not much actually. It's just not our priority to exercise. Now, it might sound very unrealistic to suggest doing exercise, so you need to mix it up. One of them, which is fun for most people, and I think everybody can do it, that is, everybody can dance. So, our next presentation is on dance therapy by Tanmay Haldar. He is a trained dance therapist. As you can see, he is a faculty in quite a few places. And I am handing over the mic to him, and let's see how this session goes.
Alright, very good evening to all of you. Leave your chair and please stand up. We cannot demonstrate dance therapy without dancing. Yeah? Everybody there, everybody. Okay, hands up. Alright. Can you have the shake also? Okay, get the hands down. Slide down. Take a shoulder. Alright, now I want you to find a partner. Keep the touch, keep the touch. Let the partner tell you what to do. Alright, can you do that? Little about how dance therapy began. So then we'll try to establish the connection that how well can it be used for a treatment in terms of depression. So all of us know that India is a rich base when it comes to dance and music and art. And we have been doing this for so long, we don't even remember. There's a birth in the family, we have a song, we have a dance. There is change in the season, we have a dance, we have a particular raga to do that. There is a death in the family, there are tribes, there are people, those who also celebrate that, right? Because there's a journey which is beginning. And this is how we have been brought up. Dance have been part of us since very, very long. Now, ideally, in the modern world where Westerners have taken over a lot of things, and post-World War II, when the soldiers and veterans came back to US, and suddenly most of them suffered from something called as PTSD and depression. Yeah, I will not get into the details of PTSD. I'll stick to depression since my friend Deya has already briefed you on that. So now they tried all kind of psychotherapy available back then. There's Mr. Freud coming in, Carl Roger coming in, yeah, Carl Jung coming in, a lot of people are coming in, but nothing works. They started something called as an ECT, what Deya has explained just now, and the condition of those soldiers did not improve. What they saw, what they experienced at war, never let them go out of the experience. So it was very challenging. And then comes in the founder of dance movement therapy, surprisingly in 1947 by Miss Marion Chase. So Marion Chase was brought in that, Miss, you are a great choreographer, great dancer. Our soldiers are just, sitting there, no therapy works, nothing is working. Just make them do some activity, at least they will be physically fit so that we can pose them back. Yeah, that was the main purpose there. And when Marion Chase came in, obviously depression has its own symptom in psychomotor coordination. From the body language, you could always know that the person is actually going through depression. The body speaks. There's a famous line which says, body never lie. Whatever is there inside you, body will obviously going to speak. Now when it comes to that, Marion Chase started building up movements. Now mind it, these people are very well choreographed in parades. They know how to march, okay, how to run, but they don't know how to dance. So how do we call dance movement therapy with them? There's the catch. Dance is an attractive term. Dance is something very, very flashy with costumes, with lots of expressions. But movement is something at the simplest level possible. So she used a movement like this. For example, how do we comb our hair? Anybody wants to demonstrate? How do you comb your hair? Everybody try doing this? Yeah? And after some point of time, you will get bored out of it. So you will be like, so how the movement vocabulary changes, she reinstated something called as that every movement that we do is being born out of boredom. Because we humans are lazy animal. So every movement, a simplest movement like this will make us bored at some point of time, and we will develop a new vocabulary extending that particular movement. And that's where she thought, why not
think positive. Now I would like Iraban Haldar to come up on stage and summarize our entire program with a couple of Rabindra Sangits, and then we will
করতে গিয়ে দেখলাম যে গানটি ইটসেলফ একটি কাউন্সেলিং সেশন, প্রবলেমটাও ডিসক্রাইব করে দেওয়া আছে, সলিউশনটাও দেওয়া আছে। এখন ইন্টারপ্রেট কিভাবে আমরা করবো সেটা আলাদা ব্যাপার। আমি সেই গানটি টুকরো টুকরো শুনিয়ে শেষ করছি। আপনারে দিয়ে রচিলি রে আপনারি আবরণ, খুলে দেখ দ্বার অন্তরে তার আপনারে দিয়ে রচিলি রে কি আপনারি আবরণ। তাই আবরণটা আমরা নিজেরাই কিন্তু রচনা করছি। আমাদের যে আবরণ সেটা কিন্তু আমরা নিজেরাই রচনা করি, আমরা জানতেও পারি না। দুঃখের বিষয় সেটা। এর পরের যে অংশটা সেটা শুনুন, সেটা পুরোটাই ডিপ্রেশন কে ডিফাইন করছে, অবসাদকে ডিফাইন করছে। মুক্তি আজিকে নাই কোনো ধারে, আকাশেও যে বাঁধে কারাগারে, বিষনিশ্বাসে তাই ভরে আসে নিরুদ্ধ সমীরণ। তাই না? সেটাই মনে হয় একদম। রোজকার নীলাকাশ, রোজকার বাতাস, কিন্তু অবসাদ থাকলে মনে হয় সব বন্ধ, ক্লস্ট্রোফোবিক মনে হয় নিজেকে। এবার তার সলিউশনটা, ঠেলে দে আড়াল ঘুচিবে আধার, আপনারে ফেল দূরে, সহজে তখনই জীবন তোমার অমৃতে উঠিবে পরে। শূন্য করিয়া রাখ তোর বাঁশি, বাজাবার যিনি বাজাবেন আসি, ভিক্ষা না নিবি তখনই জানিবি, ভরায় আছে তোর ধন। সলিউশনটা কেউ বলে দিতে পারবে না। ভিক্ষা না নিবি তখনই জানিবি ধরা আছে তোর ধন। তো আমাদের নিজেদেরই বার করতে হবে। সব আমাদের কাছে দেওয়া আছে, ঈশ্বর সব দিয়ে রেখেছে, খালি সঠিক পথটা খুঁজে বার করতে হবে। তাই আপনারে দিয়ে রচিলি কি রে, তার সলিউশনটা হচ্ছে ঠেলে দে আড়াল ঘুচিবে আধার, আপনারে ফেল দূরে। যখন নিজেকে আমার আমিকে সরিয়ে রাখতে পারি, তখন যে গ্লোবাল কনটেক্সট, আমার সমস্যাটা পৃথিবীর প্রবলেমের কাছে কতটুকু, আমার থেকে বেশি প্রবলেমে আরও অনেক লোক রোজ বাঁচছে এবং তারা দিব্যি সার্ভাইভ করছে, সেইটাও যদি মাথায় আসে, সেই গ্লোবাল কনটেক্সটের সাথে যদি নিজেকে একটু রিলেট করতে পারি, তখন প্রবলেমটা অনেক সহজ হয়ে যায়। তাই আমি এটুকু বলেই শেষ করব যে রবীন্দ্রনাথ বলেছেন, দুঃখ আছে, দুঃখ পেতেই হবে, যত দূরে যাবার আছে সে তো যেতেই হবে। দুঃখ তো পেতেই হবে, দুঃখ অ্যাভয়েড করে সে তো স্বর্গ হয়ে যাবে, পৃথিবী থাকবে না। কিন্তু তাও যত দূরে যাবার আছে সে তো যেতেই হবে। ধন্যবাদ, নমস্কার।